Welcome back to the TRT Juice Podcast, where we dive into everything related to testosterone replacement therapy and more. I'm today's host, Ryan, and today we're tackling a topic that's been making headlines for quite some time: AndroGel lawsuits. This is a big one because it has significant implications for anyone considering or currently on TRT. So, let's jump right in. So, what exactly is AndroGel? For those who might not know, AndroGel is a popular testosterone replacement therapy gel. It's designed to treat men with low testosterone levels, a condition also known as hypogonadism. You apply it to your skin, and it helps raise your testosterone levels, which can improve symptoms like low libido, fatigue, and muscle weakness. Sounds pretty straightforward, right? Well, here's where things get complicated. In the early 2010s, a wave of lawsuits started hitting AndroGel's manufacturer, AbbVie Inc., which is a subsidiary of Abbott Laboratories. The big issues? Plaintiffs claimed AndroGel increases the risk of heart attacks, strokes, and other cardiovascular problems. They also said AbbVie didn't do enough to warn about these risks and used aggressive marketing tactics that misled consumers. Let's break this down a bit. First up, the cardiovascular risks. Studies suggested a link between testosterone therapy and heart-related issues, leading to claims that AndroGel users faced higher risks of heart attacks and strokes. Pretty scary stuff. Next, the warnings, or lack thereof. Many lawsuits argued that AbbVie failed to adequately warn patients and healthcare providers about these potential risks. This is crucial because, without proper warnings, people couldn't make fully informed decisions about their health. And then there's the marketing. AbbVie was accused of pushing AndroGel for off-label uses and exaggerating its benefits while downplaying the risks. Essentially, they were accused of encouraging men to use AndroGel even if they didn't have a clear medical need for it. Misleading advertising was another major complaint, with plaintiffs arguing that AbbVie overstated how common low testosterone is and how much AndroGel could help. So, what happened with all these lawsuits? Well, because there were so many, the cases were consolidated into something called multidistrict litigation, or MDL. This allowed for coordinated pretrial proceedings and discovery. There were some notable jury verdicts and settlements. For instance, in 2017, a federal jury in Chicago awarded $140 million in punitive and compensatory damages to a man who suffered a heart attack after using AndroGel. However, some of these verdicts have been overturned on appeal, so the legal battles continue. The FDA also stepped in, requiring manufacturers to add warning labels to testosterone products, including AndroGel, about the potential risks of heart attacks and strokes. This was a big win for patient safety. So, what does all this mean for you? First off, it has definitely increased awareness about the potential risks of testosterone replacement therapy. Patients and healthcare providers are having more informed discussions, which is a good thing. The FDA's stricter guidelines also mean that doctors are more cautious about prescribing these treatments, ensuring that only those with a clear medical need are getting them. Overall, these lawsuits have led to better patient safety. The added warnings and regulatory scrutiny mean that the risks of testosterone therapy are more clearly communicated. But remember, while legal actions and regulatory changes can improve safety, it's still up to us as patients to stay informed and make decisions based on a thorough understanding of the benefits and risks. So, if you're considering or currently using testosterone replacement therapy, keep yourself informed, ask questions, and always consult your doctor before starting or changing any treatment. It's your health, after all. That's it for today's episode of the TRT Juice Podcast. Thanks for tuning in, and if you found this episode helpful, please subscribe, leave a review, and share it with anyone who might benefit. Stay healthy and informed, everyone. Until next time.